Welcome back to Wellness Wednesday. Today we're talking about something that almost everybody ignores until they start to hurt. Your feet. Think of your body as a house and your feet as the foundation of this house. Now, if a foundation of a house is cracked or uneven or unstable, the house starts to shift and compensate for this error. So your walls are going to crack, your doors aren't going to be able to close very nice, and things start wearing down faster. So the house, or your body in this case, fully relies on a stable foundation, aka your feet. Our feet are honestly quite impressive and very complex, containing 26 bones, 33 joints, and over 100 muscles, ligaments, and tendons. I'm going to share with you a couple reasons our feet are so complex. The first one is shock absorption. Your feet are meant to absorb and distribute the force of running, walking, jumping, so that said force doesn't travel straight to our knees, our hips, our low back, our spine, and this absorption becomes possible through our arches. They act almost like springs. When your feet hit the ground, they slightly flatten to absorb that impact, then they spring back to help you propel yourself forward. And the second reason is weight distribution. Your feet are responsible for supporting your entire body weight, but again, it does this in a system. When you stand or walk, your weight is constantly shifting between your heel, the ball of your foot, and your toes. And all the small joints and muscles in your foot help distribute that pressure so a single area isn't taking all that weight all at once. But if you have tight tissues, weak muscles, injury, low mobility, or just years of wear and tear in your feet, those systems stop functioning properly. And when that happens, your body still has to deal with the force somehow. So instead of your feet absorbing and distributing that impact, a lot of that stress starts traveling up your body. And that's where we start to see what we call a chain reaction. So now that your feet are not absorbing and distributing this force and this weight properly, and it's traveling up, the first place it's going to go and affect is your knees. So let's say your arch is collapsed. That impact's going to go to your knees, and your knees are going to start caving inward. Or say you have poor foot stability, your knee joint is going to have to work harder to help stabilize. Or say you have an altered walking pattern. That uneven pressure is going to travel throughout the knee and over time cause knee pain, patellar tracking issues, and joint stress. And then when your knees start to shift out of their normal alignment, your hips are going to start compensating. This can lead to tight hip flexors, glute weakness, uneven hip loading. When the hips are compensating and the gait patterns change, your lower back often starts picking up extra strain. And that can show up as chronic lower back tightness, that stiff feeling after standing in a certain position or walking too long, and just recurring muscle tension. You see what I mean by chain reaction now? And then from your low back, it just is going to keep going up until the actual issue, which is your feet, is fixed. And soon you're going to have neck issues caused by your feet. It's actually quite fascinating how the body works. One of the most effective ways, believe it or not, to support foot health is actually massage therapy. Who would have thought? Massage works by helping release tension in the muscles and fascia in your feet, improving circulation, and restoring mobility in the small joints and soft tissues. And that's really important because our feet contain so many small structures that can become tight, restricted, or overwhelmed from just daily activity. Massage can help with things like plantar fasciitis, heel pain, arch pain, all the pain, foot fatigue, Achilles tension, and calf tightness that contributes to foot pain. For more stubborn or chronic issues, shockwave therapy is the next best thing. As you guys hopefully know by now, shockwave therapy uses acoustic sound waves that are delivered into the tissue. Those waves stimulate blood flow, activating the body's natural healing response. And it can also help chronic inflammation and scar tissue that has built up over time. Some conditions in the feet that shockwave is commonly used for is plantar fasciitis, any chronic heel pain, Achilles tendonitis or any tendon irritation, stubborn soft tissue injuries, and also heel spurs. So when we think about foot health, it really comes back to what we talked about earlier, which is the fact that our feet are our foundation. They absorb shock, distribute weight, help us stay balanced, and support us through thousands of steps every day. And when the feet aren't functioning properly, it creates a ripple effect throughout the whole body. So taking care of your feet, whether it's massage therapy, shockwave therapy, can make a huge difference in your overall movement and comfort. So if you're thinking that your chronic pain is maybe caused by your feet, you should definitely book a massage or book a shockwave appointment, and we could try to get that figured out. We're going to start improving your body from the foundation up.